breast care affects every person, not just the people that are going through it. So not just the person that's diagnosed with the disease, but their spouse, their children, their grandparents, their parents. So there's nobody who is not affected by it, which means that it matters for everyone, whether you have a disease or not. Piedmont is proud of what we call the Piedmont Way. What that means is as you go through each step of diagnosis, treatment, that the people taking care of you care about all of you. That starts when you first have contact with us, whether that is in our breast health center. So if that's for your screening mammogram or diagnostic mammogram, if you've been referred to us for a biopsy, whether you get to see me as a surgeon or my wonderful nurse practitioner, Robin Myers, all of us in the Piedmont system are working to take care of you as a person and to care for all of you. As you're recovering, we also have all sorts of other things to help you through the process, such as our Lauren Smith Cancer Center, dietitians, counselors, nursing staff support groups, yoga, Tai Chi, really excellent support groups for patients as they go through this process. We have the Beautiful You Boutique. You might need specialized clothing, possibly wigs, prostheses if you've had a mastectomy. And then do you need an occupational therapist to help you with swelling in your arm? Do you need a physical therapist to help you with movement after a mastectomy? We have all of those things available to you, and you don't need to worry about knowing what you need. We will help you through each process. Having a cancer diagnosis does not mean always that you need a mastectomy. You can a lot of times keep your breast and have a lumpectomy, sometimes need radiation afterwards, sometimes not. So my job is a small amount surgery and a whole lot more of a teacher, a counselor, a encourager to help each patient that I see figure out what the right option is for them and then guide them through the process. What makes Piedmont special is the people that work here. And what makes us stand apart from other systems is our clinically integrated network. Everyone that is involved in each patient's care is held to a very high standard of quality and a high expectation of effective communication. If a patient's primary care doctor is concerned about something, they have a very easy way of communicating with me through our electronic medical record, and I get questions from their primary care doctor or from the radiologist, and we can communicate effectively through our electronic medical record so that everyone is on the same page, everyone knows the communication, and there's not a, well, I'm not sure what so-and-so said about this. Well, let me see what's going on here. If it was me on the other end of it when it has been me in the past, what I care about is that my physician knows what the plan is and can help make it happen as efficiently as possible. What we now call Piedmont Athens Regional has been here for over 100 years, serving our community. And so the physicians, the staff come and go, but it's the same goal of quality over time. Most of my patients don't want to go to a big city, don't want to travel for surgery. You want to be at home. And that's what Piedmont Athens Regional gives you, is that home feeling and state of the art at the same time.